Welcome to the Heart Foundation of Jamaica.
This week on the Trailblazers, we feature the Heart Foundation of Jamaica, which is celebrating its 50th anniversary this year. Stay tuned to hear about the work and services of this organization, their historic rise, and why they continue to be a trailblazer in promoting heart health in Jamaica. The Heart Foundation of Jamaica, HFJ, was founded in 1971 by the Lions Club of Kingston. It's a non-profit, non-governmental organization. Among the objectives of the foundation are prevention through education, early detection through screening programs, advocacy for policies that promote heart health, and rehabilitation through education on healthy lifestyles. Among its services are medical, in-house, mobile, advanced cardiac screening, sudden cardiac arrest screening, and many others. The Heart Foundation of Jamaica is critical in promoting heart health, with cardiovascular diseases remaining the leading cause of morbidity and mortality in Jamaica, and the programs and services of the foundation are focused on reducing this problem. Its messages resound with the people of Jamaica, and in recent times, many citizens have lauded the "Are You Drinking Yourself Sick" campaign, which aims to encourage Jamaicans to reduce the amount of added sugar in their diets. As the Heart Foundation of Jamaica celebrates its 50th anniversary in 2021, we applaud this trailblazer organization for promoting heart health in Jamaica. Mrs. Deborah Chen is the Executive Director for the Heart Foundation of Jamaica, and as we continue to highlight this trailblazer organization, we are happy to have a chat with her about the history and work of this phenomenal organization. Thank you so much for joining us on the program.
Thank you so much for highlighting us on our 50th year.
That is indeed a major milestone.
Yes.
So tell us, how is it that you first got involved with the Heart Foundation of Jamaica?
Okay. So I have been here since July 1992. There was an advert for a medical manager for the medical services at the time, and I applied and got the job, which I held until I think it was January 94 that I was made Executive Director.
Very good. So what has the journey been like, would you say, for the organization over the years?
It's been a long journey. I guess you don't really realize until you really stand and step back and take note. But we were in a much smaller building before with very limited services. So over the years, it has really been challenging to continue to expand, to keep abreast with what was going on globally and what was possible locally in terms of our expanded services. And having decided that, of course, there was always the funding, how you're going to get the funding. And of course, you needed team members. So if you're going to expand the services, which cardiologists would come, where would you get the equipment from, But at all times, we have had a very, very strong and committed board of directors. And along the way, we have had good team members. Some have come and moved on to other things, but everybody played their role. So it was a joint effort, but it really was challenging. And I guess at the time, you didn't really spend looking far down the road, but you knew that at every step of the way you had to improve and you had to expand. And as soon as you achieve one goal, you set yourself another goal and move towards it.
Definitely. You mentioned just now in terms of the expansion of services. Tell us, especially for viewers that may not know, what are the services that are provided by the Heart Foundation of Jamaica, and also how has it evolved from what initially was offered?
So initially we had a mobile unit which used to do heart screening. In those days it was mainly for rheumatic disease, rheumatic heart fever, before my time. And as it evolved, it got to be screening generally for heart disease. What we did first was to expand our in-house services at the Kingston office in the building next door to more screening. Then we got a doctor to start a blood pressure and diabetes clinic. And then when we got the new building, we could really do a lot more. Now we have 5 consultant cardiologists, 3 nutritionists. We still have the doctor with the blood pressure and diabetes clinic. And really it's a one-stop heart shop. Anything you can imagine that you will need to maintain heart health, we have it here at 28 Beachwood Avenue. So you could come in and just say, I want to be screened for heart disease with no letter, no idea. You just know you want to check on your heart. You just turn up, no appointment necessary, and we will do some basic screening tests. That would include the ECG, that's measuring the electrical activity of the heart, and some finger prick blood tests, which will be done in just a matter of minutes. So having done those tests, and the registered nurse would look at your questionnaire to find out your medical history and family history, we would then make recommendations as to next steps, if any. It may be that you're perfectly fine and you just keep coming back in a year and carry the result to your doctor. But if we find anything that puts you at risk, then we would take the next steps, whether it is to the heart specialist, who would then send you for other tests and so on. But we have biomedical lab here, we have a full pharmacy. So there's everything you could possibly need right here at 28 Beechwood Avenue.
Certainly a one-stop shop. And then when you look at, in terms of persons over the years and the cases that you've had over the years, any of them stand out to you in terms of how the foundation really helps to transform or to really help that person?
Yes, I think our biggest contribution is for persons who did not know that they had a problem before they came here.
Yes.
And we find that certain occasions of the year that lend itself to outside broadcasts, such as in Heart Month, we find that people hear the messages from the various media personalities and turn up and be screened. And we have found several cases over the years with really high blood pressure. I mean, so bad that we had to just say, no, you have to go straight to the hospital. I mean, even being with us wouldn't help, you know. So I think that has been our biggest contribution. The percent of people who have found to have a problem, who had no idea before they were screened. After that, it will be the persons that we have been able to maintain heart health. So, okay, yes, you develop high blood pressure. Many of us will develop that with age. But we ensure that it's monitored, it's kept on track, it's kept within check. And especially these days with COVID around, persons who have underlying health conditions are much more at risk should they contract COVID. So the heart screening is really important at this time. And we'd like to use the occasion of our 50th in particular to encourage everybody to come and be screened for heart disease. You may not know, it's not necessarily something you get a symptom from or you feel ill. So the only way to know is to check. So given that we're in a COVID environment, and any of us could catch COVID, as despite our best efforts, it's best to ensure you are in the best heart health before, so that should you contract it, at least the outcome shouldn't be as bad as it could have been.
You hear, everybody, you need to go and get your heart screenings done, and get it done right here at the Heart Foundation of Jamaica. And one man who definitely supports this cause is consultant cardiologist with the Heart Foundation of Jamaica, Dr. Edward Chung.
Came back into the island in 1981, and I've been involved with the Heart Foundation since then. Just a little story. When I came back, I was assigned to the National Chest Hospital, where I started the first cardiac unit within the government public service. And at that time, we had no equipment. So we actually got the Rotary Club of Canada to donate equipment to us. And with the help of the Heart Foundation and the Lions Club of Jamaica, they were able to help us ship that equipment to Jamaica, clear it, and we installed it in 1981 at the National Chest Hospital. So that was my very first work with the Heart Foundation, and they were very instrumental in getting the cardiac unit started. So I came on the board of the Heart Foundation somewhere between 1982 and 1983. And one of my first projects with the Heart Foundation was to set up a CPR program. And we started this with the help of Project Hope, which was a voluntary organization that had come to Jamaica. And with the help of Project Hope, we started the basic CPR program at the Heart Foundation. And shortly after that, we started doing advanced CPR.
According to Dr. Chung, the CPR program had its share of challenges.
It has been difficult because at the start, there was a lot of resistance to the start of any CPR program. There was the idea that maybe if we tried to resuscitate individuals, they would not survive, and you would have individuals that might require ventilation support that would not be available. And it took a little bit of convincing to tell people that it's an important part of the whole training of individuals within the hospitals. Now I can say that it is well accepted worldwide, both within the medical profession and within the lay people profession, that we can help, we can save lives. And since then, it has gone from strength to strength, where we have expanded it from the initial looking at individuals within the hospitals for treating them and training them to individuals all over the island, both within the medical profession, within the hospital, and also lay people. Also, the Heart Foundation is involved with the Emergency Cardiac Care Program. We have a National Resuscitation Council for which the Heart Foundation is a member, and that sets standards for CPR so that everybody does it in the same way. And we use the standards that is the ILCOR standard, which is the international standard that is used throughout the entire world. So whatever we do, whatever we train, whatever we teach is the same as if you were in Germany, Britain, or the United States. I can tell you something about an incident that happened at the hospital. I recall a lady who had a cardiac arrest. Her heart had stopped beating. And we were doing CPR and we resuscitated her. And when she came back, she looked at me and smiled and said, "Thank you. And why did you do it?" And I said, "Well, it is my job to try and help people and keep them alive." And that was when it dawned on me that it's important that everybody needed to know how to do cardiac resuscitation, because we all can help, both lay people and as doctors, to help to preserve life.
Preserving lives, that is what the Heart Foundation of Jamaica is definitely helping to do. It has established itself not only locally, but also internationally. So moving on, Mrs. Chen, in terms of leadership, because you are the executive director, and I understand you've also served in various capacities internationally. How is it that your work internationally helps to develop the work of the Heart Foundation of Jamaica here locally?
Yes, so at this point I must mention our Peter Bangata, the founder of the Heart Foundation, who passed away a couple of years ago. There was a point in our development when he decided that we really need to spread our wings. Because you see, when you're global, you learn from your colleagues, you learn, you have access to funding, and you're part of a much wider community than just the Jamaican or even Caribbean community. So in about 1993-94, we joined the Inter-America Heart Foundation, which is for all our region, you know, Canada, Central, South America, North America, and Caribbean. And then from there, we grew. At one point in time, I've been a board member and still am at the moment, a past president. We also went on to join, well, no, we were a member of the World Heart Federation from inception, let me say, from inception. But we never actually started being able to attend their meetings, which in those days, the conferences were every 4 years, till many, many years later. So as part of that, we then joined the Inter-America Heart Foundation. I eventually became vice president of the World Heart Federation as well. What it showed me was that Jamaica had a lot to be proud of in terms of our achievements of a Heart Foundation, even compared to other countries out there. So when you measure up among other countries, we were doing a pretty good job. Many countries could learn from us, just as we could learn from other countries, especially those in lower income resource settings. Yeah. So I think what it has done, it has widened our contact base. As a result, we have had speakers for our various symposiums from many other countries. We have been able to access funding. So when funding is available, we apply. People are aware of the work of the Heart Foundation, and we have had funding from time to time to help with our advocacy programs. So it really put us in a different mindset and also gave us something more to aspire to. You can be very parochial living in a small island. Yes. And I do think that we need to spread our wings and find out what's happening in the wider world. So it has definitely helped us along, and we continue to play leading roles in both those and some other organizations as well.
And would you say then that the Heart Foundation at 50 years of Jamaica has revolutionized in terms of how Jamaicans take care of their hearts?
I think so. I think there's definitely, it's hard to measure these things, right? But there's a lot more awareness, heightened awareness about heart disease. Called recently our campaign trying to alert Jamaicans to the health harms of sugar. Yes. When, I mean, I think most people now have a better understanding of how much sugar is in products that you would not be suspecting of, you know. So I think an increased awareness about what foods we eat, the sugar content, about reading labels, the importance of taking responsibility for your health. And of course, along with our colleagues of the Ministry of Health and Wellness, who we work very closely with. So I think definitely advocacy is now something that is front and center to our work. It's not good enough to just screen people for heart disease. If the environment in which we live is not heart healthy, it's going to be hard to do. Yes. So there's something we refer to as an obesogenic environment. If you live in an environment where it's hard to exercise because security issues, maybe your development wasn't built with a green space, an environment where labels are not required that are easily read by the public, an environment where high levels of sugar are allowed in school, which has now changed, things like that. So we are now focusing on policies that will promote heart health, and that way you'll have a much bigger impact on reducing heart disease in the long term, even though it's necessary to see each patient one person at a time. But definitely advocating for policies that promote heart health are also critical, along with the continued screening service.
Certainly, and I mean, that point that you mentioned in terms of the sugar content has really, that message has really helped a lot of Jamaicans. I've had co-workers saying that, oh, they put away the soda just because of that campaign. So that's a tremendous work that you're doing there.
The Heart Foundation is in a preventative mode at the moment, where we are teaching individuals about health and healthy lifestyle. So we will talk about dietary problems, we will talk about what is the proper healthy way to live, and how we actually treat individuals who have heart problems. So prevention is a very important way that the Heart Foundation is now putting their mandate forward.
There is no doubt as to the role and work of the Heart Foundation of Jamaica in helping to save lives. And that message is also shared by Chartered Accountant and Board Treasurer of the Foundation, Mr. Robert Roden. I'm delighted to be joined by Mr. Robert Roden, and he is the Heart Foundation of Jamaica Board Treasurer. And it is a delight to have you on the program.
Thank you.
And 50 years, that's a big milestone. Congratulations.
It is. Thank you again. Yes.
Yes. So, I mean, you are by profession a chartered accountant.
Yes.
So I'm curious to find out, how is it that you would have gotten involved with the Heart Foundation of Jamaica?
Well, it all started when the firm that I was being trained at to be an accountant, when I just left school. One of the partners, David Martin, was a member of the Lions Club. In fact, I think he was the treasurer of the Lions Club. And when the Heart Foundation was formed, he offered them office space in the accounting firm where I was working.
Wow. So
that was how I got connected to the Heart Foundation. It wasn't a big space, it was a very small space. And they had employed a secretary, Mrs. Eleanor Grant, and she was there just doing paperwork, typing, sending out letters. In fact, it was more of a secretariat that the Heart Foundation had established. And they were in the accounting firm. So I had access to them and obviously got close to them.
Awesome. And I mean, being the treasurer, you're the person in charge of the money. So how is it that you ensure that that part is also healthy?
As far as the money part go, I must say at the time when I joined the Heart Foundation, Mr. Bangers had made sure that there was adequate funds in place.
So you sort of continue.
So I just came in at a very good and opportune time.
Okay. But I mean, you could have come in and at the same time squandered it?
No. Well, the Heart Foundation, the people who are running the Heart Foundation would not have allowed that to happen.
Okay, definitely. All right, so in terms of significant milestones since your involvement, which ones, stands out for you based on your involvement over the years?
I think, as somebody reminded me, it must be the event of us buying this building. When you consider where I'm coming from with them, they had a little office space up at the accounting firm when they started. And then they came here, they had occupied the building across the road from us here. And then to have bought this building, the building that we, the accountants, had owned. This was something big. I mean, this was no normal feat.
Definitely.
And it just showed that the Heart Foundation had expanded so much that they needed to have this space. And that was good.
Wow. So when you compare where the organization has been, since you have been involved, of course, to where it is now, what kind of comparisons can you draw?
the Heart Foundation has been phenomenal. I mean, it's unbelievable where they're coming from. And you know, I recall when we came here, they had just the same Mrs. Grant, they had a manager, Mrs. Shearer, and about 4 or 5 staff. And they were being trained to do ECG and heart blood pressure checks by a nurse from the University Hospital, who was also a director, Mrs. Sherry Lopez. And they started the mobile clinic, yes. And it's amazing. I mean, they just grew, and they just kept on going and going and going, you know.
And now
to the point where they had outgrown the space and needed somewhere much bigger than where they were.
And as we mentioned, our 50th anniversary, that's a big deal. The program is called the Trailblazers.
Yes.
Would you say that the Heart Foundation of Jamaica is a trailblazer organization in Jamaica?
Oh yes, it has been so, yes.
And why would you say that?
Well, you know, in the field of medicine, at the time when the Heart Foundation had started, there were hardly anyone else providing the services that the Heart Foundation was providing. But if you look at over the years what has happened, there have been a lot of, you know, trailblazers is exactly that, right? You have a trail and you're blazing and others are behind trying to follow you. And if you look out there, you'll see other medical institutions trying to do the same thing that the Heart Foundation has been doing. Albeit, I think we are still the trailblazer.
So then if the others are, you know, because perhaps they're emulating then, but you have set the trail and you're blazing it.
Yes.
What sets you apart? What sets the foundation apart over all these years?
Well, you know, we have always been in the medical side of it, but you know, in recent years we have been into a lot of advocacy, where we have been, you know, trying to educate the Jamaican population on things like obesity, albeit it still affects the heart, right? Yes. And so much so that I think that's where we have separated ourselves from a lot of the others who are probably just merely providing a blood pressure check or ECG. You know, we have taken it beyond that.
Definitely. So on this, their Golden Jubilee, their 50th anniversary, we salute this trailblazer organization, the Heart Foundation of Jamaica.
I hope that we'll have another 50 years of success and that there will be others coming along who will take over and ensure that that is so.
It's a testimony to the work that the Heart Foundation has done, that the public has accepted the work that we do, and they look towards the Heart Foundation as a leader within the society, both to help them in their own medical needs and also in the preventative needs. I would say to the Heart Foundation, hearty congratulations. We have done a tremendous job. First 50 years, we started with small steps, and now we are moving much stronger, and we need to build on what we have done.
So we'd just like to thank all the Jamaicans who have used our services over the years, because as small as the fee may be, it helps us to help others. Continue to support us, especially corporate Jamaica, to help us with medical equipment and so on. But at the end of the day, we just like to encourage all Jamaicans to be screened. You need to be screened. You need to check your heart. You cannot sit at home and know for a fact that you don't have high blood pressure, high cholesterol, that your heart is working properly. So please do an annual screening check. And if you want to learn CPR, we also have that as well at the Heart Foundation of Jamaica. So make it your goal to visit the Heart Foundation Jamaica during our 50th year. And if you can't make it, then certainly have your heart checked by your health professional.
Make it your goal. Come on board to the Heart Foundation of Jamaica and get tested, get involved, take care of your heart, and contribute to a heart-healthy Jamaica. Thank you so much, Mrs. Chen, Executive Director for the Heart Foundation of Jamaica. And of course, we continue to celebrate with them as they observe and celebrate their 50th anniversary.
Hey everyone, I am Tamara McKayle, producer and host of the Trailblazers series. Remember to hit the notification bell right below, subscribe, like, comment, and share. And join the Trailblazers family for weekly inspirational episodes every Sunday.